Hello, dear scientific committee and dear applicants. I'm talking about the elongation, derotational, flexion, casting, treatment of this early onset progressive scoliosis and skeletal dysplasia. I have no disclosure. The background of the study, the elongation, derotational, flexion, casting technique was utilized and the efficacy has been confirmed for early onset scoliosis. However, in the skeletal dysplasia, scoliosis has not been confirmed in the children with skeletal dysplasia. Purpose of the study to determine the efficacy of the EDF casting in the patient with skeletal dysplasia by measuring spinal growth until the operative growing growth and definitive fusion is indicated. Inclusion criteria are patients have to be under the 7 years old, diagnosed with skeletal dysplasia, major curve greater than the 2.5 degrees. Exclusion criteria are non-sequential casting and spine surgery prior to ADF casting. Outcomes, what we measured, and the major minor curve angle, T1, T12 height, space available for lung convex and concave side, peak inspirator pressures, and rib vertebral angle difference. And we measured all the variables in the 4 timelines, pre-casting, in first casting, in the last casting, and the last follow-up without casting. We have the 11 patients, and first casting age is average is for the month age of average of the serial casting numbers 9.7, mean duration of the casting 35 months, renewal the casting 3.8 months. So we have the 7 thoracic thoracolumbar curve, 1 thoracic curve, 2 only thoracolumbar curve, 1 thoracolumbar and lumbar curve. And these measurements in the 4 timelines, and I talk about only the statistically significant things. Major curve angles between the pre-casting and the first casting is statistically significant. You see the decrease in the first after the first casting, and the T1, T12 height and between all the timelines are statistically significant. P values is also statistically significant, PIP2 and between the PIP2 and the PIP3. And the conclusion of the study, EDF serial casting is time-saver treatment, 35 months. Prior to the surgery, is keep curve angle is stable and allows the spinal growth during the casting. But after the casting treatment, surgical plan should consider as possible as quick. Thank you very much.